just concentrate on this area, and we'll just go through. But yeah, I know what you mean with that, with the autonomic nervous system patients. Yeah.
All right. Mary Jo, any comments, questions, whatever?
Maybe one or two things may come into mind. Headaches, just kind of generally, and I was just had a patient who had migraine headaches from very early childhood, like 4 or 5, and I'm just wondering what you might think, would be causes for that so young. And the other thing maybe...
How old is she now?
Mid-50s.
Okay, so she's had the headaches for 50 years.
Yeah.
Okay.
Yeah. And the other thing, but not the same patient, is I find that a lot of people have sleep problems.
Sleep, okay.
Yeah, just, especially women, I think, appear not to sleep well. And I have been doing insomnia heel point for most of them, but they're not reporting much, much improvement.
Yeah. Okay. So let's talk about the headaches and then the insomnia. Yeah. So this particular person, at age 4 or 5, she started getting headaches. What else is going on in the medical history? And by the way, parents and grandparents. So Jamie, that's something that even men are willing to talk about their parents' medical history, because, oh, that's not me. I'm not vulnerable, but my parents had this thing. So, but what do you know anything else that she has?
Well, she did mention that her grandmother actually had migraines as well.
Okay, and is that the only thing there is in the whole medical history, or is
there? Oh no, she has. She was extremely fatigued. She had shingles. I possibly contacted you about this person, Abby. I'm trying to think. I just haven't seen her for a couple of weeks. So what else? Yeah, just actually all her back was just really sensitive. Even kind of touching her whole back.
She jumps. Okay.
Yeah.
Yeah. The type that when you touch the back, there is a reaction, even though you just put your hand on and immediately there's some jerking. There's 2 things to that. One, it's an autonomic nervous system's issue, and number 2, it's a liver 8 indication. Okay. And so I would check her liver. I'm not trying to promote the TCM view of liver young rising or anything. It's not that, but there's a chance that she's a liver type. Yeah, you wonder what it is that at age 4 started headaches. But now, how does she describe these headaches?
It seemed to be like on the vertex, the top of the head. She felt them mostly.
Okay. And do you know what her blood pressure is?
As far as I can remember, I think she said her blood pressure was low.
Okay. So I would treat blood pressure, just, if it is low. And the other thing, so you can look at a few options around it. So very similar to blood pressure treatment, which is spleen 6, spleen 9, under the third toe plus pericardium. Instead of under the third toe, but in this case, you'll just add it, you do lung 5, and that's called stagnant blood in the head. Okay, because she has to do 20, maybe not by palpation, maybe by palpation, maybe there's some heat, maybe there's some puffiness, there may be something under 20. So that could be one thing to look at, is stagnant blood in the head and or blood pressure and or both. I would, because of this sensitivity in the spine, it means that the nervous system is sort of revved up. So you already have under the third toe, you could check the SCM and or cervicals and look at Sanjiao 8 or 5 if she's rapid pulse. And you do 2 on the back. couldn't be important. And look at liver 8 as an option. And I would check her liver and see, physically the right side under the ribs and see if that gives you another clue. I find that I personally tend to often forget checking the liver under the ribs.
She did show adrenal, but as far as I can remember, not liver.
Not liver. Okay.
Yeah.
So, okay. So here's another weird way of working. So you're saying to yourself, gee, I think it's liver. Okay. Now you don't know for sure, but you're thinking. What you do is you check if liver 8 is going to clear the adrenal symptoms, the reflexes. And if it does, it tells you something. It says to you, okay, the liver isn't showing, but the liver treatment clears other things that it's not supposed to. Whenever a point is clearing something it's not supposed to, it suggests that it's really the right thing. Okay, so if you trying to clear, you have adrenals and you're clearing it with, say, kidney 6 and 27 or kidney 7 and 27, that's not a big trick. That does not prove yet, especially if the patient's not getting better, that this is the right thing for the patient. Okay, but if you're using, say, under the third toe and it clears the adrenal, then you're going, this point is going beyond its scope. It means it's really central for this person. So it's the same notion of the medical history, finding the thing that really reaches beyond its official capacity in the text. And then, so, you just have an idea. Avi said it might be liver. You check liver 8 didn't work. Maybe you check liver 1 just for the sake of it. What the hell, extra. And then it doesn't work, you throw it away. No big deal. But you have another way of working with it. So Lawrence, that comes to York, emailed me yesterday about a case of headaches of this woman that he said she said her problems were headaches, and then he said when he touched her feet, she was like jumping off the table. He couldn't touch her feet at all. So there's something really weird there. And I said, it's this thing about some people, if there's no chwai, if there's no pushing down into the foot to grow up, then that will also create the headache. And my suggestion was he determined it was autoimmune because she had a lot of rheumatoid conditions anyway, very young in her 30s. And he said as soon as he did REN 4, her feet were much better and her head was better. And he said that, the reason he emailed me, he wanted some advice because he said, well, her husband called before the next appointment yesterday or whenever and said, her headaches were gone, but her feet are still hurting. And I'm thinking, well, okay, but you never complained about your feet. It was only when he touched the feet that that was not your major complaint. How come you're not coming back? So it's a little odd. But the thing is, it's not uncommon for you to have problems in the feet and as a result, something in the head. So I would look with headache often. First thing you want to do is release the neck with a headache. Look at blood pressure, because that can affect the headache. Look at the mechanical constrictions that might be leading to the headache. Look at any hormonal issues, but for a girl at age 4, we don't tend to think that it's hormonal. So it's a little bit, weird. Look at the spine. So, you already know that the spine is weird, because you're touching and it jumps. And I'm going to suspect that somewhere between T7 and T2, she might jump even more, but I could be wrong on that. And that you might be able to release with small intestine 9-10. You might, and do too. I'm not sure. It will depend. And I had one more thought about the headaches. And the other thing is if they're not pushing down into the feet so that there is an upwardness in the body, there's a quote unquote fluffiness in the body. So that will be inner yin and mushu. Okay. Now your advantage of inner yin is besides the fact that it's part of the chwai of creating a downward and upward movement in the leg to support the torso. Inner yin also happens to release the trapezius. So, you know, they have headache, releasing the trapezius is probably a good idea anyway. So you, again, always look for things that are multi-purposed as much as possible, as opposed to, but headaches are generally, they're either hormonal, pituitary, you know, an actual brain damage thing, you know, so remind me to go over that, and or blood vessel issues. And the most common headaches are blood vessels. You know, it's something in the blood vessels that's not working well. So if it is a brain damage situation or an actual brain thing, there's a chance that there'll be a little nodule above kidney 3. So for example, if you're doing adrenal, rather than doing kidney 6 or kidney 7 or kidney 9, see if there's something above kidney 3 and use that as your adrenal. You know, needle that upwards. Do 2 can be quite useful, and gallbladder 39 can be quite useful. So these are different options. Insomnia can be really easy or really difficult. So it kind of works well, you know, either they come back, you know, the people who never told you they have insomnia, they come back and say, oh, I'm sleeping so well now. You know, that's like the typical, you know, like the patient that we like that says, oh, acupuncture is so great. I feel so wonderful. My appetite is better. I'm losing weight and I'm sleeping better. And then you ask them, and by the way, how's you heal? Oh, what heal? You know, that's the patient you like. So, and then there's the ones that, you know, it's just a long protracted thing because there is some underlying problem in the body. So the insomnia itself can create problems in the body, and other problems in the body can reinforce and or create insomnia. And, you know, so the problem is that once these two things meet, it becomes a little bit complicated and intractable. So it's a long-term situation, you know, like really trying to move the body little by little by little by little and seeing what happens. So officially with insomnia, they're supposed to show either REN 17 or REN 15, possibly REN 9. They're supposed to show around T5 and T7, and T7 is, the T7 line is considered autonomic nervous system SHU. So both for asthma and insomnia and things of that nature. So see if you find something tight around UB17 and use that as a reflex. And at the end, you can needle and moxide. Releasing the upper thoracics is very important, including actually needling them. So small intestine 9-10 is going to be very important for them, and do 2. And again, strangely enough, whether they have, and so we're back to the headache a little bit, but because I was going to say, because I'm thinking off the back, UB35 can be very important. Okay, so UB35 is a point supposedly for Chwai, for being able to push down to move up, but it's also called support the support. So if a person is constantly slumping, when they go to sleep, they've been sort of in a weird, they've not been in full awake mode the whole day. I mean, yes, they're doing things, but in the body, there's something that's down. So therefore, when they're actually horizontal, the nervous system doesn't distinguish between the two so well. So you kind of want to jack them up with UB35, which is called Cheng Fu, supporting the support. So somebody who wants to go to sleep needs support, kind of thing. And officially the other reflex is going to be, sorry, this was not very methodological. The other reflex should be in the occiput for insomnia. You know, GB20, Anmian, you know, those areas. So that's, but it's kind of a long-term, slowly, because the nervous system, once it has a habit, is not going to change the habit so easily. You can soothe the nervous system, so you can release the SCM, you can do all these things, but then the nervous system has to sort of grab onto it and say, okay, I'm willing to take that on. It's different when you're treating, say, something like acid reflux. okay, and you're doing Samjiao 8, releasing the SCM, and the acid reflux gets better, because then what you did is you treated the autonomic nervous system, you gave it, let's say, a 5-minute break or whatever. The nervous system didn't really grab onto it, but maybe the esophagus and stomach did. Here, you're trying to make the nervous system itself not just release, but grab onto the release on a more permanent basis. And it's not going to be willing to do that. So it's a longer term, because you're treating the nervous system for the nervous system, as opposed to treating the nervous system so that something else can let go. Does that make sense?
Yeah, yeah.
It's a different phenomenon. So that's, just have patience. And yes, I agree with you that the heel point is actually better for pain. It's a supporting point. And in my opinion, that is not your major point for insomnia. Your major point for insomnia is figure out what's going on in the body and treat the body. At the end, when they turn over and you do the back, by the way, Moxa, the heel point, and or if you have diet rings, just put diet rings on it. It works, in my opinion, just as well.
Okay.
Because the moxa is a drag, they don't feel the, they can have thick skin, they don't feel the moxa on the heel so much. And I find that, taping a diet ring on it is just as effective.
Okay. Thank you.
You're welcome.
I've found treating the gallbladder points on the scalp with a few clients has quite a sedating effect.
Yeah.
They mentioned once you put those in that it's almost like they feel like they're sedated and they'll just go to sleep on the table, and that's helped with a few of my clients that have had trouble sleeping.
That's
left, yeah,
15. Left 15, 16, 17.
Yeah.
Yeah.
Yeah. Yeah. They ask for them. They're coming because it's like they're getting a sleeping pill or something. It has quite a sedating effect.
Yeah.
And then I've had other clients that I've needled those points and they've asked that I never needle them again because they've had the opposite, where it's agitated.
Interesting.
Yeah.
Can I ask you what size needle do you use there?
The dark green ones, the 12, 0.
Yeah. Okay. No, I was just wondering, because it's, if using a thicker needle, that maybe that can have an effect on some people.
It's probably only the one, maybe I use it a lot of, it's only 2 clients that have sort of had an adverse reaction. Most of them really like it.
Yeah. But 2 is enough to make you wonder, is there something here I need to watch out and figure out what's common to these 2 clients, and because you don't know, you may come up with, okay, gallbladder 17 is not good for the following types. You just never know how that's going to come across, why that's going to happen.
Yeah, that's interesting.
Yeah, I honestly don't know. I have to say, I don't use gallbladder 17 so much. My favorite is, for the same effect is Sanjiao 22.
Sanjiao
22.
Side.
No, not here. Around Taiyao. Yeah. And
yeah.
All the way, you're a little high for my taste. I would go like where the ear meets and go to the front and then look. And often, this comes from Yamamoto. He says that area is for cervicals, and cervicals should show around large intestine 11 as pain. So you choose the side if they have some pain around large intestine 11, one side. I use Sanjiao 22 on that side to release that and anything else I can. Sanjiao 22 is called He Liao. He means harmony, and Liao is, they translate as a bone hole, but really the character is like, it has the bone in radical in it, but it also has, it's like the hair, it's like something that flaps its wings and makes a big noise, like the swishing noise. So it's like a conch. Okay. It's like, and which means it's not just a hole in a bone. It's something that has the ability to emphasize. Okay, kind of like the conch emphasizes. So a liao, there's lots of liaos in the body. I haven't done the count, but it might be the most popular point name. It might be, I don't know. I can't guarantee it. But you know, besides the four liaos in the sacrum, there's tons of them, and this is and it's the only point that has the character harmony on it.
Yep.
Okay. Now Yamamoto uses it to release the cervicals. Yep. And the thing is, if you release the cervicals, you're pretty much releasing the body. It's the same thing that, you know, we talk about, release the SCM, and you're releasing the nervous system, releasing lots of things in the body. So it's a really, so I don't have as much understanding of gallbladder 17. I don't use it quite so much as other people, but I do use this a lot.
Yeah.
So
gallbladder 17 I'll use for patients that have quite severe anxiety or panic attacks, and they've got quite a lot of pressure pain on REN 17. Always get a good result of releasing or whatever's left over after I've done everything else. If there's still REN 17, I put those points in, and it's just, it gets rid of it in those kind of patients anyway. Yeah.
Great. Excellent.
Yeah.
So anything else?
I had a patient ask me, Abby, about was there a particular needle to help somebody make a big decision?
Yes, the 3-inch needle straight into wherever. It doesn't matter where. Just make the fucking decision already. I mean, I would assume that it has something to do with, you know, something like nervousness, anxiety, you know, maybe grounding them, you know, but it can come from so many different places. So I would say just figure out what you think is the cause of this and do the best you can with it.
Didn't they teach that I remember at college that it was the gallbladder or something?
Yes,
or something.
Yeah, it's a cute theory, and it might really work. I don't know, but you know, so I think, you know, take whatever, you know, but isn't, well, you know, the gallbladder is courage and makes decisions, but the liver is the commander. I mean, there's lots of, and then, you know, the problem with all these things is that you can make an argument for many things. So, for example, the spleen is ultimately the.
I did, spleen came to mind, but then actually when she had gone, I realized the liver was courage, isn't it? I think it was more like a courage thing that you to make a kind of an important decision, you know.
Right. Well, that's what Jamie's saying, that gallbladder is the decision, that is the courage and the decisions. But the thing is, all these things, regardless, are related to consciousness, to awareness, okay, which is the yi, which is the spleen. So every time you're working on an emotional issue, in my opinion, you need to somehow work with the spleen in some manner. And also, you know, depending on how much flutteriness or anxiety there is around it, Sun Jiao is very important because, you know, so we say, yes, the Sun Jiao is the 3 burners, but Jiao is written, it also means anxious. It's literally written like a bird on top of the fire, meaning you're roasting a bird. So the bird is getting anxious. You know, I would get anxious if I was someone's shish kebab, you know. So, you know, so that's another, you know, so, you know, you get an explanation of how come Sanjiao 8 is so important. You know, how can we use Sanjiao points to release the neck, to release anxiety? So my sort of go-to dogma is anything that has to do with nervousness, anxiety, emotions. Look at the spleen and look at the Sanjiao. And with that, you then, of course, get the pericardium, because pericardium and spleen are good friends. They, you know, we always do spleen and pericardium. It's like a standard combination. And then, of course, Sanjiao and pericardium are, you know, paired. And I believe that the spleen and the Sanjiao are opposite each other on the clock. I could be wrong. You call Richard Tan and he'll let you know if I'm wrong. So, but I always start there, and then you can look at, you know, see what needle they're, you know, what's the other needle that's gonna like jab you and get you to make a decision. I think it's,
well, it wasn't her main. She just brought it up during the treatment. You
oh
know, it wasn't.
no. I understand, but I think, but it suggests, yeah, I get that, but it suggests something. I think with decisions, I mean, for me at least, it's often not about the decision, it's about the fear. What if I made the wrong decision?
Yeah.
You know, it's like, so you make the wrong decision, you know, it's not, it's okay. Life continues. Worst case scenario, it continues without me, but life still continues. So I think so. And so that kind of hesitation, you know, there's too many options. There's too much rumination. Yes, so supposedly the gallbladder will, you know, because the bile clears stuff out, is the idea behind this. You know, just get rid of that, you know, just pave the way, just throw some bile in and emulsify it all. Or look at the spleen, you know, which is, you know, there's all this thinking,
yeah,
you know, and just, but you can also say, well, you know, it's kidneys because it's the will. You know, I'm just willing to live with, gee, lucky me, I have 20 zillion decisions that I could make. So you can go any way you want. And this is where palpation is very useful. That you can sort of say to yourself, it's not some idiotic idea that I made up. You know, oh, it's the kidney, oh, it's the gallbladder, oh, it's the lungs, oh, it's, you know, because, you know, you know, we can make something up for everything. But then I'm saying, okay, it's this. And then I'm saying, it shows itself to be useful on the body. Therefore, it has a chance of doing something. And whether it will or won't, hard to know, but you've got a better chance than if you just go with just theory. So that, unfortunately, it's not something I have a good dogma for.
Okay.
So.
Bladder 49, I always seems to manage to work its way into quite a few treatments. And, you know, because there's quite a bit. And if you got an idea and you think it might be that, you can test it against anything that you find. If it's the right point for them, you'll find out, you know.
And it makes sense. It's, you know, according to the, you know, the idea that the outside the bladder shoes is supposed to be the spiritual aspect of, and this is outside the gallbladder shoe. So it makes perfect sense.
Yeah. And normally I will talk to them about that aspect to the point as well to see if it resonates with whatever they're going through. And generally it'll make sense to them. And, you know, it's helpful with those points to sort of just in your communication with them. I do anyway, you know, have a talk about the point. Whatever point, if I found some significant point that does a lot and releases a lot, I'll chat to them about the point and the point's indication and the energetics of it as well. And
okay.
I'll resonate. Yeah.
So, you know, you can't say you do Kiko style because Kiko style, no talking.
No.
No, I'm kidding. So, no, I mean, that's the thing. You take what, you know, you take it and combine with other things.
Yeah.
And, you know, perfect. So, the only thing about gallbladder, not gallbladder, bladder 49, you know, outside gallbladder shoe, is it's a little hard to test. In other words, you have to go under.
Sorry, maybe I got the wrong point. I was talking about Yishu.
Oh, okay. Yeah, okay. That's outside spleen shoe.
Isn't that bladder 49 or is it?
If you say, oh, wait a second, you guys use a oh my goodness, you guys are using an old system maybe. I don't know what number it is.
Yishu anyway, the spleen.
Outside the spleen shoe, yes. Needled upwards.
Yes.
Okay, yes. So you're back to spleen, and okay, so this is a point I was going to suggest that regarding gallbladder shoe, also outside gallbladder shoe, because it's just, you know, one above, is this is an area where people are falling down. The rib is like falling down. Okay, that's why you're needling it upwards. You know, because you're needling it against the channel, so it doesn't work very well in some weird manner, but you're needling it upwards in order to support, to lift the ribs up. Okay, otherwise everything is, they're falling down, and you get sort of more and more stuck in you, so so yeah, actually it fits Mary Jo's question, her patient's question, is there a point for a needle for jack me out of this situation? So yeah, that actually fits the description very well. And yes, I use the, Isha also a fair amount. Yeah. On people with, but it also has you can literally see it physically, that there's a slumping in the lower ribs, that there is no upward and forwards movement in the rib, so it's all slumped into the waist. So it really makes sense. Yeah.
Yeah, it's a great point.
Yeah, it is.
I got the original classes. David Euler released, he did quite a few, and they were the first ones. You're talking about the different styles between the different teachers. And so his style is very much protocols,
yes,
palpate kidney, adrenal, immune, put in kidney, adrenal, immune, then spleen, pericardium, turn over, do the back. But which was very helpful in the early stages of doing this, because it drummed the protocols into me. So
yes.
But and then once I started watching yours, and also the Kiko's ones, she's kind of like a bit of a mad scientist,
Yes,
going all over the place, but it's helpful. Those David Euler ones were really helpful in the beginning of just formulating the basic protocols, as well as the books, obviously.
No, and that is very much, well, so a few things to understand is that David, as far as I know, now he works, I believe, 2 days a week and sees, maybe 80 patients a day. So that's a huge number of people. Now he has assistants, whatever, but so when you're working that volume, you need to rely on protocols very, very heavily.
Yeah.
Most of us don't see this volume. So we have a little bit more capacity to shift around and experiment. So to understand that, and also it has to do with personalities, of course, that some of us like protocols, and some of us, if I call it dogma, it sounds very derogatory, but some of us like that kind of clarity, and some of us like to walk away from the rules. So yeah, I think that I don't know how many, so he has a bunch of videos that are available all over?
No, they were released online, probably about just late 2008, 2009. He did one on fertility, one on an intro, scar treatment, and a neck and shoulder one.
So they're like short videos?
No, they're long, full 10, 12-hour seminars, yeah.
Okay, I wasn't aware of that. So yeah, I mean, he is, if you want clarity about protocols and stuff, he is definitely the person. And then if you want more creativity, if you're looking for that, David is probably not your best resource. But you need that underlying, even if you are going to be a mad scientist, you need that base regardless.
Well, Kiko, the great thing about watching her is if she's doing a seminar on do 16 for back pain, she'll make that point work for everybody, whatever they've got. She'll somehow find a way that'll release the whole back or the whole abdomen or small intestine 11 or whatever she's working on. And there's an intentionality behind that, which is really helpful as well too. It gets back to the story. So if you've got a story and there's an intentionality behind the story, and the patient's kind of on board with it as well, that you can really make get things moving and working well. That's what I've really learned off Kiko, is just have that confidence that I have an idea, and fuck, this is going to work. Like, you know.
Absolutely. No, it's very true. It's very true. And I will tell you, as someone who teaches, and I, you know, who teaches by treating patients in front of other people, which is a risk. That capacity of saying it should work is very helpful. Sometimes it's not as helpful in the clinic because you can make mistakes and convince the patient of the mistake.
Yeah.
Or the patient's body of the mistake, and it will catch up. But in a you know, for first time treatment, in order to get the patient to trust you also, just like you want the students to trust you, sort of thing, it's very helpful, and it works a lot better, of course, in a larger situation where there's a lot more energy than just in the treatment room.
Yeah.
Because there's not as many people kind of pushing that. Yeah, it is very helpful to sort of say, damn it, this should work, and convince you're somehow convincing whatever the gestalt in the room that it can work. That is a useful skill, no question. I agree.
Yeah. And if that doesn't work, just go back to the protocol.
Right. Well, yes, and there's nothing wrong with going back to protocol. I mean, really, and you know what? I'll say something very controversial. There's nothing wrong with, you know, you throw your hands up and you say, large intestine 4, liver 3, you know, because I don't know what the hell to do with you. And it's like, let's hope that something magical happens to you. It's okay. Yeah. That's what you could do at that moment.
That's not very satisfying, though. I've tried. I've resorted to that once, I think, and it was just recently with somebody. And as a patient, she came in and she was really angry, and she had sharp pain on liver moo sort of point, and I just checked sort of that, and it's a patient that I treat a lot, and she's got thyroid issues, and I've mainly been treating Hashimoto's autoimmune, and for some reason I just thought liver, and I thought I'll just try the large, and you know, because I treat her. Sometimes patients, they come back for a long time, and you go, what am I going to do this time? You know, they want to come back for treatment. She had this thing, and I thought I'll just try this. You know, the 4 gates. I'd never done it. I wonder if this have any effect on that, you know, and it didn't do anything at all. And in fact, you could see, and then I was trying other things. You could see she was getting grumpy as you keep palpating. She's like, oh, and you go, I can't keep palpating. And I thought, just go back, kidney 3, check the thyroid, and just check kidney 3, and bang, and she got instant relief.
Yeah, because if you treat the person's underlying thing, this is going to match them no matter if they're too angry, they're too upset, they're too sedate, they're too whatever it is, it matches them. And 4 gates is not so likely to match your patients, it will match other people's patients because it's not your thing.
No.
It's not likely to work for them. It's kind of it's a waste of time for you to bother.
Yeah, well, I was in.
But you tried.
Yeah, I spent 2 years in when I was at college, because obviously we get taught TCM at college, and in the second year I'd already done a year and a half in the student clinic, and I was almost ready to throw it in because I thought, you know, I've been treating for 18 months and I hadn't seen any results where you could go. You know, people would keep coming back, and you see them for a few months, and now they're going to get better, or they feel sorry for you, and they go, you know, I'm feeling better. But at the point I go, you know what, I think this is placebo, like nothing is happening. And that's, I got an email from my association about Monica was coming, Japanese acupuncture. And there was a couple of my friends were doing a different style of Japanese acupuncture at the student clinic, and everyone was all the clients had turned up and asked to go and see them. So I thought there's something going on in there that we don't know about. So I just, on a whim, I just took this class while I was still at college, and I couldn't believe it. Just the first day of palpating, and I go, Mike, why aren't we taught this at college? You know, like you push at a point and something changes, you get an instant result. I was sort of amazed and angry that I'd spent 4 years at college and I didn't even know that. And I went back to college and I'm showing my teachers and I go, look, and they go, oh, how did you do that? I go, I don't know. What I got taught.
Read the damn book, you teacher.
Yeah, they didn't know. So I the last half of the year, I went back. I couldn't practice TCM at all, so I'd have to go in. I go in with present my case, and the lecturer go, okay, well, it's liver yang rising, spleen, liver 3, and then I just go back in and do Kiko, and just because I couldn't justify.
Yeah.
Just putting in spleen 6, liver 4, large intestine 4 again.
Yeah. All right, people. I need to move because it's not midnight on my time clock. It's the beginning of my workday. It was nice to chat with you, and I'll be here next week, and we'll see what happens.
Great, thanks, Adi.
I hope that was useful.
Thank you very much.
Thank you. Bye.
Bye.
Bye.